How precise is a lumbar puncture for misdiagnosis? Imagine trying to solve a complex puzzle where some pieces look alike but belong to different pictures. That's similar to diagnosing multiple sclerosis, where doctors piece together clues from various tests. One important piece is the lumbar puncture, often called a spinal tap. This procedure involves inserting a thin needle into the lower back to collect cerebrospinal fluid, the clear liquid surrounding the brain and spinal cord. The goal is to look for signs of inflammation or immune activity that might suggest multiple sclerosis. In misdiagnosis, the main focus of the lumbar puncture is to detect oligoclonal bands in the cerebrospinal fluid. These are specific proteins that indicate immune system activity within the central nervous system. While their presence is common in people with MS, they are not exclusive to the disease and can appear in other neurological conditions. The sensitivity of this test, meaning how often it correctly identifies those with MS, is about 75% at the initial diagnosis. That means roughly 3 out of 4 people with MS will have detectable oligoclonal bands in their cerebrospinal fluid. The test specificity, or how well it rules out those without MS, is high but not perfect. Oligoclonal bands can also appear in conditions like infections or other inflammatory diseases. It's important to remember that not everyone with MS will have positive findings on a lumbar puncture. Some people may have a negative result, especially early in the disease. Conversely, a positive result alone does not confirm MS because other conditions can produce similar findings. That's why the lumbar puncture is just one part of a comprehensive diagnosis, which also includes clinical evaluation and magnetic resonance imaging scans. Speaking of accuracy, some sources suggest that the lumbar puncture can be about 90 to 95% accurate in identifying MS when the disease is present. However, this can vary depending on the stage of the disease and individual differences. False negatives can happen if oligoclonal bands are not present early on, and false positives can occur if other inflammatory or infectious processes are involved. The procedure itself is generally safe, with common side effects like headache or back pain. Serious risks are rare but can include infection or bleeding, which is why it's performed under sterile conditions with local anesthesia. In recent years, advances in magnetic resonance imaging have changed how MS is diagnosed. Modern MRI scans can detect characteristic lesions in the brain and spinal cord, sometimes making the diagnosis possible without a lumbar puncture. Features like the central vein sign can improve accuracy and speed up diagnosis. For some patients, this means a less invasive route to confirming MS. Despite these advances, lumbar punctures remain as valuable, especially when MRI results are inconclusive or when doctors need to rule out other conditions. The decision to perform a lumbar puncture depends on each person's symptoms, medical history, and test results, and should always be guided by a healthcare professional. Remember, no single test provides a definitive answer for MS. Diagnosis involves combining clinical judgment, imaging, and sometimes cerebrospinal fluid analysis. The accuracy of the lumbar puncture is high but not absolute, so results must be interpreted carefully within the broader context of each individual's health. Ongoing research continues to refine diagnostic methods, and the role of the lumbar puncture may evolve as new evidence emerges. Always consult with a qualified healthcare provider for personalized advice and interpretation of test results.